Hello, my friend. I'm Dr. Anna Whitmore. For more than 25 years, I've worked with people just like you, men and women in their 50s, 60s, even 70s, helping them understand and protect something most of us don't even think about until it's too late: our kidneys. I know. Let me ask you something personal. Have you ever looked in the mirror and noticed your skin looking different? Maybe your eyes are puffier than usual. Maybe your nails don't look the way they used to. Or perhaps your skin feels so dry that no lotion seems to help. Most of us chalk it up to just getting older. We tell ourselves it's age, it's stress, it's the weather. But what if your skin wasn't just reacting to the outside world? What if it was whispering a warning from deep inside your body? You see, your skin is not only the largest organ you have, it's also one of the most honest. It tells the truth often before we want to hear it. And for many of my patients, their first warning sign that something was wrong with their kidneys didn't come from a blood test. It came from what they saw in the mirror. So today I want to walk with you slowly, gently, through 12 subtle but powerful skin signs that your kidneys may be in trouble. And I'm not here to scare you. I'm here to open your eyes. Because the earlier we notice, the more power we must change the outcome. You wake up in the morning, splash some water on your face, look in the mirror, and those bags under your eyes just won't go away. Now, sure, maybe you didn't sleep well. Maybe you had salty food last night. But what if it keeps happening day after day? I had a patient, Martha, a 62-year-old grandmother. She came to me worried about her eyes. "Doctor," she said, "I look like I cried all night, but I didn't. I just wake up swollen." When we ran her tests, we found her kidneys were leaking protein into her urine. You see, when your kidneys are weak, they can't hold on to protein the way they should. That protein slips out, and one of the first places you'll notice it is puffiness around the eyes. So next time you see swelling under your eyes that won't go away, even when you've rested, don't just blame it on a bad night's sleep. Your body may be telling you something deeper is wrong. Now let's move from the eyes down to something we glance at dozens of times a day, but rarely think about: our nails. Have you ever looked at your fingernails and thought, that looks strange? Maybe half the nail is pale while the other half is darker. Maybe your nails feel weaker, ridged, or brittle. This isn't just cosmetic. Nails can be windows to your bloodstream. In kidney disease, waste products build up in the blood and circulation changes. That's when we sometimes see half and half nails, the top part white, the bottom part reddish brown. Not from nail polish, not from trauma, but from imbalance inside the body. I remember a gentleman named Robert, 68 years old. He loved gardening, never wore gloves. When his nails changed color, he assumed it was just from the soil. But no, when we checked, his kidney function was down to 40%. His nails had been warning him for months. So, let me ask you, when was the last time you really looked at your nails? Not just for grooming, but for health. Sometimes they're writing the story of your kidneys right in front of you. This one surprises many people. Imagine feeling a hard little bump under the skin of your finger or around your elbow or near your knee. At first, you brush it off. It's nothing. But then you notice it's firm, almost gritty, like a tiny stone buried under your skin. These are not pimples. They're not calluses. They are deposits of calcium and phosphorus that build up when the kidneys can't keep your minerals balanced. I want you to picture this. Your kidneys are supposed to be like a filter, keeping what your body needs, and letting go of the rest. But when the filter breaks, minerals that should stay in check start spilling into places they don't belong, like under your skin. One of my patients, a retired teacher, told me, "Dr. Whitmore, I thought these bumps were just old age." But when one of them broke the skin and leaked a chalky white substance, she realized something was wrong. And indeed, her kidneys were in late-stage disease. So please, don't ignore strange lumps under the skin. They're small on the outside, but they may be shouting about something much bigger on the inside. Now let's talk about something almost everyone over 50 has experienced: dry skin. But I want to make a distinction. Normal dry skin is one thing. You put on some moisturizer and it feels better. The dryness I'm talking about doesn't respond to lotion. It feels like sandpaper, cracks like old earth, sometimes even flakes like fish scales. I want you to imagine this. Your body is like a garden. The kidneys are the gardeners, making sure every cell gets the right balance of water and minerals. But when the gardeners fail, the soil dries out. And no matter how much water you pour on top, the roots remain thirsty. This is why people with advanced kidney disease, especially those on dialysis, almost always report severe dryness. But here's the thing. That dryness often starts years before dialysis is needed. It's an early whisper, not a late scream. A gentleman once told me, "Doctor, my wife buys me every cream in the store, nothing works." That was his clue. His kidneys weren't holding water where it needed to be inside his body. So, if your skin stays stubbornly dry, no matter what you do, don't just blame the winter air or old age. It may be your kidneys crying out for attention. Let's move from the face and nails down to your feet. Have you ever noticed your shoes feeling tighter as the day goes on? Or perhaps you slip off your socks in the evening and there are deep marks around your ankles? This isn't always just age or too much walking. Sometimes it's your body holding onto fluid it was supposed to let go of. Your kidneys act like gatekeepers for salt and water. When they're weak, the gates don't close properly. The extra fluid begins to pool, first around your ankles, then in your legs, sometimes even in your hands or under your eyes. We call it edema. I remember a patient of mine, George, who told me, "Doc, I thought my legs were just tired, but then my wedding ring wouldn't fit, and that scared me." Sure enough, his kidneys were struggling to release water, and his body was quietly drowning inside. If you notice swelling that's symmetrical, persistent, and not explained by an injury, don't just brush it off. Your body is waving a flag, asking you to listen. Now, let's talk about something that can drive you absolutely crazy. Itching. Not the kind from a mosquito bite, not dry winter skin. I mean itching that won't quit day and night across your back, your arms, your legs. Sometimes there's no rash, no redness, nothing visible, just an invisible irritation that keeps scratching at your nerves. Why does this happen? Because when your kidneys can't clear toxins, those wastes stay in your blood. They irritate your skin from the inside out. It's like your body is trying to scratch its way free. One of my patients told me, "Doctor, I wake up with my sheets bloody because I scratch in my sleep." That broke my heart because it wasn't just a skin problem. It was his kidneys crying for help. If you've ever felt this burning, crawling sensations with no clear cause, please don't ignore it. Gentle remedies like oatmeal lotions, cotton clothing, or cool compresses may help for a while. But the real solution lies deeper, protecting your kidneys. When itching persists, the skin eventually starts to show it. Some people develop red patches that don't fade. Others find thickened, rough areas that feel almost leathery. And then there are those stubborn rashes that return in the same place again and again, no matter how many creams or steroids you use. This isn't eczema. This isn't seasonal allergy. It's your body trying to push out what your kidneys can't filter. I'll never forget Susan, a 70-year-old retired nurse. She came to me frustrated. I've tried everything, lotions, creams, prescriptions, but these rashes won't go away. When we tested her kidneys, the answer was clear. Her skin wasn't the problem. Her kidneys were. So, if your skin suddenly changes, itchy, rough, inflamed patches that refuse to heal, don't keep buying creams at the pharmacy. Stop and ask the deeper question, could this be my kidneys talking? And now, let's talk about something that often hides in plain sight, the overall tone of your skin. Maybe you look in the mirror and your face seems more pale than usual, or perhaps there's a grayish, almost ashy look. Sometimes even a faint yellow tint creeps in. Most of us blame it on fatigue, on aging, or just looking washed out. But in many cases, it means your blood isn't being filtered properly. Waste products build up. Anemia sets in. And your skin, that honest storyteller, reveals the truth before your lab results ever do. I had a patient once tell me, "Doctor, my friends keep asking if I'm sick, but I feel fine." His skin was giving away the secret. His kidneys weren't cleaning his blood the way they should. Your complexion is like a reflection of your inner bloodstream. If it suddenly shifts to pale gray or yellowish, don't dismiss it as just age. It might be the most visible clue that your body is asking for help. When itching becomes relentless, the skin eventually pays the price. I've seen patients come in with raw patches, darkened scars, even tiny hard bumps that never seem to heal. And it's not just from scratching too much, it's because toxins that should have been filtered out are trying to escape through the skin. One of my patients once told me, "It feels like my body is fighting me from the inside out." And in a way, she was right. Her skin had become the battleground because her kidneys could no longer carry the load. If you're seeing marks, scars, or strange textures that don't make sense, pause. Ask yourself, is my body trying to tell me something deeper? Now, this one is serious. One of the most alarming signs of advanced kidney failure. Imagine waking up one morning and finding sudden blisters on your hands, your feet, maybe even your face. They weren't caused by shoes, by burns, or by any clear injury. They just appeared. These are called uremic bullae. They happen when waste products overwhelm your system and force their way out through your skin. I'll be honest, if you ever see this, don't wait. Don't assume it will go away on its own. This is your body's emergency siren. Get medical help right away, because by the time blisters show up, your kidneys may be at the edge of shutting down. Another quiet but dangerous sign is when small wounds or cracks take forever to heal. Maybe it's a cut on your hand from gardening. Maybe it's the heel of your foot, splitting and painful. Weeks go by, and it's still raw. Or worse, it becomes infected. When kidneys are weak, they don't just struggle with fluid and waste. They also affect blood flow, hormone balance, and the body's ability to repair itself. That's why healing slows down. I remember a gentleman who told me, "Doctor, I used to recover from scratches in days. Now it takes weeks." It wasn't just about age. His kidneys were quietly changing the way his whole body functioned. So, If your body feels slower to heal than before, don't dismiss it. Healing is a mirror of inner strength, and when it falters, it may point straight to your kidneys. And finally, let's talk about something small but powerful: tiny red dots under the skin. These spots, called petechiae, look like pinpoints of bleeding, often on the legs. They don't blanch when you press them, and they can mean your blood is struggling to clot properly because your kidneys aren't regulating things the way they should. I once had a patient look down at her legs and say, "Doctor, I feel like my skin is dotted with warnings." And she was right. Those dots weren't random. They were her body's way of crying out for help. If you notice unusual spots, especially if they keep appearing, don't ignore them. They may be the last whisper before something bigger unfolds. My friend, we've just walked through 12 ways your skin may be speaking for your kidneys. Puffiness, nail changes, strange lumps, stubborn dryness, swelling, itching, rashes, changes in skin tone, skin damage, blisters, slow healing wounds, tiny red spots. On their own, they may seem small, but together they tell a story. And that story is simple. Your body is wiser than you think. I know it's easy to say I'm just getting older, but age is not the enemy. Ignorance is, because what you notice early, you can act on. What you ignore, you may lose the chance to change. I've spent 25 years listening to patients tell me, "If only I had paid attention sooner." I don't want that for you. So here's my invitation. Listen to the whispers before they become screams. Look in the mirror, not just for wrinkles, but for clues. Notice what your body is saying. Bring it up at your next checkup. Because you deserve clarity. You deserve strength. And most of all, you deserve to live these years with energy, not decline. If today's message spoke to you, please don't keep it to yourself. Share this video with a friend, a spouse, or a brother who might need it. You never know whose life you might protect. And if you found value here, hit the like button so I know you're listening. Subscribe to stay connected, because every week I share doctor-backed, heart-centered ways to protect your kidneys, your heart, your mind, and your energy as you age. Take care of yourself, trust your body's wisdom, and remember, sometimes the smallest signs carry the biggest truths. I'm Dr. Anna Whitmore, and I'll see you in the next video.